Physiotherapy is part of the medical sciences that we often hear about, especially when we see football matches. When a player gets injured, a physiotherapist is someone we usually see the first one running up to the player. Well, normally we think that physiotherapy is just a few exercises or massages and a little bit of movements to kind of heal you. But is that all there is to physiotherapy? To dive a bit deeper into this subject, joining me on the 365 show today is Dr. Priyanka Ramchandani. Doctor, welcome to the show and thank you for taking time out of your busy schedule today.
Thank you.
So, doctor, in short, what exactly is physiotherapy?
So I remember when we were in our second year studying, this was a question asked to us by our professor, and he asked us, what is physiotherapy? I remember that day, this was the most difficult question for us. And today, after 8 years, it still remains to be the most difficult question. But to make it very simple, I would say that it is a science that deals with human motion. Not just limited to that, it deals with every aspect of human motion, movement, behavior. It considers and it grabs into its circumferences, the neurological system, the musculoskeletal system, the mind, body, psyche, connection, everything. So physiotherapy has to do so much with not just sports, it is everything. It includes neurological conditions, pediatric conditions, musculoskeletal sciences, women's health, that is during pregnancy, and even if you want to prepare your body to conceive, during the pregnancy and post-pregnancy fitness. So it's basically the mantra of physiotherapy can be movement is medicine.
Yes.
Our body is made to move.
Exactly.
So why not keep it that way?
No, initially, I had a friend of mine who suffered something called Bell's palsy, where there's a partial paralysis of the face. Now, initially, doctors were like, he went to a neurologist and he got medication. But that's where they recommended that person to a physiotherapist. Now, that is something when I heard was something new that I didn't really understand. Like, a neurological problem is being recommended to a physiotherapist, and turns out that they would kind of rekindle the nerves on the face by ways of massages and different exercises. So what exactly is it that a physiotherapist does when a person comes into their clinic?
So first things first. For example, if we have a fracture, who do we go to? Do we go to a dermat?
No.
No, right. So we know that if we have a fracture, we walk into an orthopedic orthopedic doctor's clinic. So similarly in physiotherapy, it is not just limited to a particular thing. Like I said, neurological conditions. Bell's palsy is one of the neurological conditions. Many people think that physiotherapy has so much to do with massages, with releases, with some movements here and there. But no, we have like a huge spectrum of interventions to choose from, and it further divides into 6 dimensions, 6 specializations, like musculoskeletal sciences, where anything related to body aches, the general population can walk into this physiotherapist's clinic. Neurological conditions includes stroke, palsies, like you mentioned, Bell's palsy, or a disease called Parkinson's. So all these fall into neurological conditions. Pediatrics, there are babies being born with different kinds of problems, ailments, conditions that may not have like a cure, but physiotherapy helps manage such conditions. So that falls into the pediatrics bracket. Then we have women's health, and we have geriatrics. Geriatrics is a branch that deals with people aged above 60, 60 and above. So those, there is fitness for those people also. That group of people are also fall under the huge umbrella of physiotherapy. Then there is physiotherapy specifically towards sports sciences. So there is something called as sports specific training. There is something called as sports specific testing. So not just a random physiotherapist cannot intervene into any team.
Okay, so there are specializations basically within the physiotherapy.
Within physiotherapy, yes. There is something called as cardiorespiratory physiotherapy also. So people in the ICU, right?
Hmm.
They have breathing problems. They have a lot of secretions.
Hmm.
There are so many conditions that can be dealt with a physiotherapist who is specialized in cardiorespiratory conditions. So basically, getting the person out, making people ambulate as in mobile, making them walk. It is not easy for somebody who's been bedridden for a longer time to just start walking.
Yeah.
So that bridge between the person coming from the bed and getting into activities of daily living, that is ADLs. So we bridge that gap as physiotherapists, and it is very nice, and it is a very satisfying profession, I would say. That we get to witness miracles happen, and it just not happen over a snap of a finger. It takes time. When we were talking, I was talking to you about what falls under this category, what falls under physiotherapy. I am reminded of this one thing, that so many people expect that, so many people also judge physiotherapists based on how fast they can get them back to life or make them pain free. So I would like to break this myth that we do not come with magic wands. We try our best to help people get out of the pain that they are facing. A good physiotherapist is not the one who gets you out of pain sooner, but the one who knows how to manage your pain, who knows how to keep you fit for a longer time, and teaches you how to be self-reliant in the future. Who teaches you to be independent, and who teaches you to fall in love with movement and at the same time keep yourself fit.
Doctor, speaking about a lot of myths, physiotherapy has been surrounded by a lot of myths, It's not, sad to say, but it's not one of the most, spoken about forms of medicine. Okay, just to start breaking down a few myths, is it true that a physiotherapist is someone who is only referred to by a doctor, or can someone just walk into a physiotherapist clinic and seek treatment?
So physiotherapy is an absolutely independent science. So when I address any crowd, I love educating people about what physiotherapy is. So when I address a particular crowd, I always ask this question: how many of us have a general physician or a family doctor?
Yeah.
Most people. You also.
Yeah, everyone has
family
family doctor. Yes.
So I tell them, in the next 5 years, you will all have a family physiotherapist. So given the sedentary lifestyle, given the fast-paced lives that we are into, given that we have 24 hours yet no time.
Yeah.
So we are all occupied with so many things and so many distractions and so many things that prod us during the day. Our health is going for a toss. Most of us, even now, even when the two of us are sitting, we are not sitting like in a proper posture. I'm sure most of us face this aches coming over, just below the neck, and most of us are just sitting slouched. Or we don't realize, but that has become so. The curvature of our spine is a C. It's an S-shaped curve, which is going towards a C-shaped curve.
So this is a very common problem, because normally now, like when you have like this, office goers and all, they're usually hunched up for like 6 to 8 hours continuously over a desk.
Absolutely.
So would there be some tip for such people? Because a lot of our viewers will probably be watching this at home, probably on a couch or something like that. A little tip that they could just basic things that could get them to sit right and maybe stand right, something like that.
Okay, so this reminds me of a very renowned chiropractor and a physiotherapist, Dr. Sudarshan Singh, who tours in cities in India, and he comes to Goa as well. So while he was here the last time, and he was asked about a tip on what to do to correct our posture and to keep our bodies fit, to which his answer was, your next posture is your best posture. Don't stick to one position. Don't just sit for longer hours at one place. Make yourself move, change your posture. So that's the easiest tip.
way.
Easiest tip is your next posture is the best posture, and I think I grabbed that. I'm stealing that statement for today, and it's absolutely right.
Right.
Yeah.
Indeed. Also, another misconception, doctor, is that physiotherapy is basically a bunch of exercises. Why don't I just Google some few exercises for this ailment and I could do it at home? Why do I need to go to a physiotherapist?
That's what most people do. So I'll tell you something. So when I have some patients coming, they're not all, some, they will be like, if we teach them some exercises, they'll be like, oh, I know this exercise. I've already seen this on YouTube. This has, I'm so used to it. What new can you give? So, as a physiotherapist, I feel that we don't limit ourselves to exercises. We see what the person needs. Now, physiotherapy is not a one size fits all concept.
Yeah.
So, if one person walks in, there is a thorough assessment that is done. After that assessment, we don't just see a person's body. A person's condition does not reveal a lot about him or her. So there is history taking, there is data collection that we do. We ask about their own medical, surgical history, about how their social surroundings or how their environment affects their psychology, or how happy they are or how stressed they are. So there are so many aches and pains in the body that are directly correlated with the amount of stress that a person has during the day. So after that, we choose from all the interventions that we have in front of us the best one that would suit the person. Say for example, if a person needs a release, so I would do something that helps him or her first, get relaxed, have some release, and then we make sure that we inculcate movement. And exercise is very specific. So if a person comes with a problem, I will see which part needs to be, given exercise. Which part needs exercise prescription, and what muscle specifically has to be targeted. So that's a glitch where I see fitness trainers also do this. So many fitness trainers are not certified and they practice, preaching different forms of exercises to the crowd. But like I said, if you do not assess properly, you will not be able to intervene properly.
Also, doctor, now when they say this, when physiotherapists sort of massage, when they try to sort of trigger the nerves and all, how close, people say the doctor is going to give me a massage and send me home, but there's a lot of study and there's a lot of reasoning behind what you'll do. So how do you all when patients come, they're kind of wary of what a physiotherapist does. So how do you all handle that situation where just to convince a person it's not a massage, it's actually a medical therapy, it's like surgery. Right, surgery is not just cutting open a body and doing a thing. You have reasons for how you do it and why you do it.
Absolutely. So massage is one leaf of the whole tree. Okay, that's how I like to put it. So massage is one technique that we are taught to help people relax, have that release. And after that, again, it is not just limited. Again, like I said, if massage has to be one leaf in the whole tree, we have to see what other things I can give to that patient. Or like I said, our goal, a good physiotherapist's goal is to teach people how to self-manage their own pain condition in future, right? So after massage, there are a lot of interventions again. Like many people do not consider dry needling or cupping or all of that. See, all of those are adjuncts. I'm not saying dry needling cures a condition or dry needling helps get people rid of pain, but it is one of those, again, a tiny leaf that we use as an adjunct to maybe accelerate pain relief, accelerate healing, maybe cupping also, any intervention. My mantra is, if it helps your patient come at ease, if it helps your patient feel better, if it helps your patient get results, do it. Right?
Yeah.
There is nothing right and wrong. If treatment A suits you, it may not suit me. If you may find something comfortable or uncomfortable depending on your body type, I may not find the same effects. You may get a 10 on 10 result after a particular exercise. The same exercise may not suit me, right?
Yes.
So also it all of this has to be combined with a lot of patience. That's the only thing I tell my patients. If you are coming to me, point number one, do not expect overnight results. It is not a quick fix. Secondly, the only thing that I like from your side is to cooperate with me. Right? So if I tell you to do something, make sure you do it. And if you do it, I promise that in due time you will get the desired results.
Doctor, we'll take a short break. After the break, I really want to dig a little bit deeper as to more myths and sort of also get to know what exactly physiotherapy is in a little bit more detail. So join us back after a short little break. Hello and welcome back. You're joining me on the 365 show with Dr. Priyanka. Dr. Priyanka, to get back on the myths and the general topic of physiotherapy. Now, when a person walks into a clinic, normally when we go to see a doctor, it's either a doctor sees us, maybe he might check our heart rate, blood pressure, he'll write a prescription, you're home, right? It's quick. You're not there for more than 10 to 15 minutes.
Yes.
How does it go in a physiotherapy clinic?
So, when a person chooses to come to a physiotherapist, the assessment itself takes about 20 to 25 minutes along with history taking. When you say that a person usually goes to a doctor, gets a prescription, goes back home happy, so this reminds me of a vicious cycle that a patient goes through. So I have made a flowchart which I would like to explain.
Yeah, sure.
So a person who has pain first goes to a doctor. Second, if he is Indian, waits for it to get worse. Because the tolerance is too high. So we generally wait for it to get worse. So if you choose the option of seeing the doctor first, you are given medications for say X number of days, 10 to 15 days, painkillers along with antacids, both of which have detrimental effects, long-term effects on our bodies, on our organs. The person chooses to take painkillers, or option B, the person chooses not to take painkillers. Okay, once you take painkillers, you're happy for those days because it's a quick fix. You are immediately relieved of pain. The pain comes back again. It's such a loyal friend. It comes back to us again. And again we get into that cycle of going to a doctor. We go to a better doctor now because we need better medications, because we need a faster fix. So we get better medications, we get them for a longer duration. Again, the pain comes back. Now when it comes back, years have passed, years, months, weeks have passed. So the pain is a little more stubborn, takes time to go. Slowly the resort turns to surgery. We need replacements, we need surgical interventions. Surgery also has two parts, successful, not successful, both of which have their own complications. And if at all a person is taken for a replacement surgery, replaced parts also have a life. They will not be there forever, they will not be able to, like it's a new thing in our body, so our body needs to accept it. It's a foreign particle, it's a foreign thing inside our human body. And our human body is not made to, function with something foreign, anything for that matter. If I put your neighbor into your house, I think
that will be a little awkward.
So you will need time to first accept the neighbor, even though you've been seeing that person. It becomes difficult for you to accept somebody else in your own home, right? Our body is just like that. It is such a comfortable home with all our parts that are being given to us, that the way the body is made so beautifully. So if something foreign comes in, again, there are complications, there's time to adjust. Like I said, coming from the bed to the floor, to getting up, to walking is it's a time consuming process. At some point in life, you will have to get into something time consuming, that is post-op physiotherapy, or when you're fit and young, you get into movement, right? You have to choose when you have to get into fitness. It's either now or it's later in life. So that cycle post-surgery, again eventually you will have to land up to a physiotherapist. So why do you want to complicate it so much? You have pain, you see a physiotherapist. You have discomfort, you see a physiotherapist. In fact, sports-specific trainers, specialized physiotherapists also help normal people with designing their fitness routines. How much weight they should take, what type of training they should get into, what type of exercise they should do, what type of muscle contraction their body requires. So that is, physiotherapy is not meant for the unhealthy. It is meant for the healthy population also, because you must have seen people at the gym.
Yes.
Everybody does the same sort of exercise. There are so many types of trainings also that can be. Many people do not like gymming, but they do it for XYZ reasons, because they're forced to do it at some point in life. They want to shed weight. They may be having different goals, right? But a physiotherapist can actually help you design that so scientifically. So I mean, it's backed by evidence, it's backed by science, it's backed by it considers your liking also. If you like a particular type of workout, maybe you are a person who loves working out outdoors, so a physiotherapist can help you design that. It is like a prescription that is really worked on, calculated and made and served to you as per your liking. So that is where physiotherapists also come.
Doctor, when you spoke about this gymming, that was an interesting thought. When I go to the gym, there's a trainer and he'll be like, do this exercise and it'll be the same, and he'll be like, this targets this muscle and all that sort of thing. And he'll say like, go to a nutritionist, right? If you want to get fit, you come to me for training, and you go to a nutritionist for your nutrition needs. Does a physiotherapy play a role in this? Because I've never heard anyone say like, go to a physiotherapist, see whether your flexibility or motor movements are correct. Because I've heard people, when they do a certain exercises, they become stiff, and then they realize it much later when they can't even wrap their arms around themselves.
Absolutely. So fitness has many parameters. I'll name a few. First one is mobility, then there's joint range of motion, then there's muscle strength, there's endurance, both muscular, cardiovascular, there's agility. There are so many prongs to fitness that a human body really needs to be assessed on every parameter. Like you said, we see gym goers bulking up, and people have this myth that if you go to the gym, you bulk up. I have been gymming for the last 6-7 years. I'm not bulked up, and I wonder why. I should be, right? But then that's not happened, because when you target every aspect of health, and if you understand this basic science that you really need external sources for any person to bulk up. You need steroids, you need high levels of testosterone, you need really high protein intake. And when we talk about nutrition, I would like to address that fitness is like a tripod. It really needs you to take quality care of 3 things: your food, your fitness, your movement, that is, and the third one is your sleep. Most people today are not getting this quality deep sleep. That is, there are 2 types of sleeps, NREM, REM. So people are not getting quality sleep, people are not getting quality nutrition, people are not moving enough. And I'll tell you the reason behind this is that there's a lot of comparison. So if you are going to a nutritionist, I will also go. If you are eating that to lose weight, I will also eat that. If you are liking that type of exercise, I will also do it because you got results, so I will follow what you did. But what may work for me may be something very, very simple. Maybe a 15-minute workout every day would work for me. Something that I really enjoy if I'm having that good amount of sleep. So a person burns off maximum calories during sleep. So that's why if you have a good quality sleep and if you're relaxed enough, the fat burning happens really fast. Now this is a very deep science which I can save for later. The entire fat burning process, the entire muscle metabolism that gets into picture when you exercise.
In fact, when I was, before I got you on the show, I saw that you yourself, as you preach, you yourself had gone through a whole transformation, right?
Yes.
How was that journey, if you don't mind sharing with us? A lot of people say I'm going to lose weight, but it's not sustainable. They'll do it for a few months and then they get back to their old diet, their old sedentary lifestyle, and you have kind of testified yourself. Yes. You put yourself on the hot seat and kind of shown it's easy, I've done it. Why can't you?
Given this platform, I will take the most advantage of the platform that I am given the opportunity by you. So I would like to say that fitness is the easiest thing to do. So many people think that losing weight is a struggle. It's the hardest thing to do. For that matter, there are people who struggle with gaining weight also. There is that population also. Let's consider them also. Losing weight, gaining weight, maintaining your fitness, maintaining health, everything is easy. Everything is easy. So let's start breaking this thing, breaking this big myth about losing or gaining weight. See, if it's important to you, you will do it. And if you really like doing it, you will do it. If you enjoy your workout, you will show up every day. What happens is, as humans, the best quality that we have is adaptability.
Correct.
Right? So if you get adapted to working out, it will be very difficult for you to stop. That guilt will not let you sleep properly. And secondly, what happens with such a thing is that we go on expanding our circle. We tend to meet people who are having the same kind of goals, who are willing to work towards themselves, towards improvising themselves, their mental health, their physical health. And what fitness does majorly is not just changing our physical selves, but helping us getting mentally very strong, building that mind-muscle connection. So fitness is super easy, super doable, and super maintainable, or if that's the word. So it is sustainable, I should say. Yeah. So it's very sustainable. It should be your priority. It should be something that you enjoy, and it should be something that makes you happy.
Well, okay, before we end the show, you have a clinic yourself. Can you tell us where exactly this is, and where the patient can walk in, or do you have to sort of get a recommendation or kind of take an appointment?
In fact, they can also come to chat with me to get educated a little about fitness and human health in general. I am like a tiny drop in that huge ocean, and my fellow physiotherapists also, who are working so hard to educate and teach people and get them towards good health. I personally am privileged to have a center in Porvorim. So it is called SHR Physiotherapy Clinic, where a holistic approach is what we strive to work towards. And yes, we see musculoskeletal cases, women's health cases. I have specialized in community-based rehab, which also encloses women's health, geriatrics, and general conditions, musculoskeletal health conditions. Yes, so this is my area of expertise, still getting better at it day by day with more and more patients.
Okay, doctor, thank you so much again for coming on the show and taking time, and it has been a pleasure having you on the show. It has been fun. We've gone way beyond the time, I just stopped worrying about the time. It was so interesting. So thank you again for coming on the show.
I lost myself as well.
I hope to see you again on the show someday soon.
Sure. Yes, and thank you for having me.
Yes, thank you again, doctor. And keep watching GOA365.